Good Tuesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to those providing vaccine to folks in our community. As we know, this is a massive undertaking and there are many moving parts. As we've said, we are looking to additional community partners providing this, or looking forward to additional community partners providing this vaccine as more distribution points in the county will increase access. As we've mentioned, similar to what happened with testing, if you remember way back when, even though we started off as the primary point to receive a COVID test, that is no longer the case. And testing is now widely available in our community. We are hopeful that this will soon be the case with vaccines as well. But right now, vaccines are not widely available. To this point, Kchd has received 4,700 doses of vaccine, which is nowhere near enough to vaccinate everyone in the first priority groups. Just to put this in perspective, there are over 30,000 residents in Knox County who are over 75. Hospitals in our region have also received vaccine, and at this point, those are primarily being used to vaccinate their staff. Long-term care facilities will have their staff and residents vaccinated through federal partnerships with select pharmacies. This week, we here at Knox County Health Department are vaccinating individuals in group homes for people with intellectual and developmental disabilities, which is a priority group outlined in the statewide plan for us. At this time, there are no opportunities for any scheduled appointments this week. So please don't call our public information line to schedule an appointment, as again, there are no appointments available at this time for this week. If that changes, and we're working to do everything we can, we will immediately make a public announcement through a news release and on our social media and all of our online platforms. As we mentioned last week, we are in the process of creating an online appointment scheduling platform for folks to register for appointments. Instead of calling the public information line, that'll still be available as well, but we want another method. We will have more information on this platform as soon as it's available. Our priorities here locally in Knox County at the Knox County Health Department continue to be getting this web-based platform live, working with the state to get regular and consistent shipment of vaccine so we can plan, and working with our community partners to increase vaccination by creating more distribution points. The supply of vaccine is the overarching factor, and everything we do is dependent on the vaccine that we receive. For our vaccination update, Knox County Health Department continues to vaccinate those that fall within 1A1, 1A2, and those who are over 75 or 75 and older, sorry. You may begin seeing some other counties moving through the phases more quickly. We've talked about this before, and that is to be expected and is dependent on several factors, including the size of their population and vaccine uptake among their qualifying groups. Here in Knox County, as you know, we have a relatively large population and have seen great uptake among priority groups to date, which is great. It is a very good thing, but that means it will take some time to move through the phases. We expect demand for this vaccine is going to outpace the supply for some time. Moving forward, we hope to begin receiving vaccine on a consistent basis, which will help us schedule more regular opportunities for vaccination and allows us to make them known further in advance for the public. But even then, supply will likely not be able to keep up with the demand for the foreseeable future. We say this not to discourage, but rather to manage expectations. We want our community to know that if you want to get the vaccine, you will be able to get one. It just might take some time. Likely it's going to take several months for us to move through the phases. And now we'll move on to the local situation. We have 191 new confirmed cases since yesterday's report. 5,397 are active cases. 177 Knox County residents are currently hospitalized. And sadly, we have 6 additional deaths to report today, raising our total to 379. And now I'll open it up for questions.
All right, the first question submitted from our media members in the Zoom chat is from David with WBLT. Why is Knox County not participating in the new statewide tool that lets you make a vaccine appointment?
Yeah, the statewide system was designed for this, the health departments that the state oversees. And so that's the 89 counties that are not considered metro county health departments. So that's their system and how they're working their operation. And we're working to get ours up just as soon as possible as well.
Also from David with WBLT, can you go to a different county for the vaccine if you live in Knox County?
Yes, you can get vaccine anywhere that it's available, and you can get an appointment, and that's throughout Tennessee.
From Alan with Inside of Knoxville, in the interest of making sure all vaccine is used, could walk-ups be allowed for the last portion of your vaccination events?
They're going to be working on addressing what those plans look like. That's not anything that's in our on our radar right now today in our planning for that. So wait and see how we're going to handle those.
From Allie with Knox News, is KCHD concerned about the president's move to add people age 65 and older to the current list of eligible groups? How will KCHD and other providers vaccinate another group when people in phases 1A1, 1A2, and 75 and up are still getting vaccines?
Yeah, that's a challenging one, and we've talked about that a lot since the news came out. While we agree that that's absolutely should be a priority population to get it, the challenge is, as we said in our opening statement, the supply is just not there right now. And so what we are recognizing and what we see every day in our phone bank and with other folks that are reaching out to us is really just a really high and understandable level of frustration by people who are in the priority groups currently that want to get vaccine that can't get it because we just frankly don't have it. And so we're concerned that that's going to continue to increase as they add more people into the groups. We haven't heard what Tennessee is going to do at this point based on the information that came out today, but it is a concern. So we're going to go back to the real message that we want everybody here today to hear from us is that there is still limited supply. So we are going to do everything we can to get it out as quick as we can. But until that supply is flowing regularly, this is going to continue to be a challenge. And we really ask for patience from people.
From Alan with Inside of Knoxville, once vaccinated, could there be a role for volunteers in helping with supporting the vaccination efforts? And if so, where should they sign up?
We'll be working with some, looking at how we can involve more volunteers into our process, and we'll get more information out as soon as we get that finalized as well. But we are looking at opportunities for that.
Also from Alan, what caused the drop in hospitalizations over the last week from 205 on January 5th to 177 today? Isn't that the opposite of what had been anticipated?
It is. And there was actually some discussion yesterday that we were seeing a few days of downward trends in hospitalizations, which is a very good sign. I think we just need to give it a little bit more time to see if that trend is going to maintain, which would be great, or if it's not. But we saw the same thing and we're asking questions about it as well.
From David with WBLT, is Knox County still holding the 2 doses of vaccines?
No, we have, no, is the short answer of that. We will get the second dose of vaccine out as soon as we get it. And we're having plans to get that out at their time frame to get it. So I think we're okay. So on that point, we got the Moderna vaccine is what we've been given out, and that's a 28-day window. So we're working those plans to get those out at their appropriate time frame.
From Austin with WATE, HHS Secretary Alex Azar has called for releasing more doses / not holding them back for second doses and urging governors to open up to people 65 and up, and most importantly, younger than that with comorbidities. With eligibility potentially changing, why open this up more when you're unable to vaccinate now? Can we advocate in any way to get more vaccine?
I think everybody's advocating to get more vaccine. That's very important. And that's what we're talking about now is there's definitely a supply demand issue here. And we want everybody who wants and needs a vaccine to be able to get it. But we're just going to have to follow what the state and federal government tells us and how much and utilize the vaccine. The vaccine that's allocated to us. That'll be our way forward for the immediate future.
From Grace with WBIR, at this rate, it will take a year or 2 or 3 before we can vaccinate everyone? Are you expecting things to pick up at some point? Could you explain what factors could help?
I think absolutely things will pick up. I think that there will, as more vaccine supply is available, and then we can actually also increase access points, that will increase the availability to get vaccine out. Again, using the analogy we used back in the beginning of our statement today, looking at how testing rolled out. There's always some time to get things rolling logistically, supply chain, all of those things take some time. And then you'll grow those access points, just like we grew testing access points. And we think that will happen soon. Just don't know the exact time frame of that at this point.
Also from Grace with WBIR, how long does the vaccine last? Will the first round of vaccinated folks need to be vaccinated again before we get everyone else in the state taken care of? So the vaccine,
I'm going to answer that question. I think what we're trying to get to. So there's 2 time frames on the vaccine. Pfizer, there's a 21-day time frame between the first and second dose, and Moderna has a 28-day time frame. That's the planning time frame there. If somebody doesn't get the second dose at that time frame, they can still get their second dose later. They don't have to start the series over or anything along those lines. Right now, the debate that's happening is whether to hold back those second doses or get all of the first doses out and then have the second doses roll in behind. We have to follow the guidance that we're given on that from the state and federal government.
Also from Grace with WBIR, has Kchd started giving out second doses? What is that process like, and how do people sign up for that?
We have not started giving out second doses because we haven't hit the time frame to do that yet. We will be reaching out directly to those people who got their first doses from us to let them know what that plan is. But like we said last week, it'll be separate vaccine clinics from our primary clinics for right now. But they'll get notified from us a little bit closer to time that their vaccine is coming due.
From Allie with Knox News, is Kchd anticipating any changes to the vaccination plan once Biden is inaugurated?
We know what you know at this point. We've seen what he's pushing for in his plans that's in the media, and we'll see how that rolls out after inauguration.
From Grace with WBIR, what's your current policy for leftover vaccine or no-shows?
Our current policy as far as is to not waste a dose of vaccine. That's the bottom line of where we stand with that. And so we will try to reach out to our partners and folks internally that are still within those priority groups to get the leftover doses of vaccine. But the bottom line is to not waste any vaccine, period.
Also from Grace with WBIR, how do your recent contact tracing changes impact schools?
Saw some headlines on that didn't really seem to line up as much with what the story itself entailed. So I'm glad to have the opportunity to talk about that because the story is really well written that was out there. So it does have some changes. We are not contact tracing, so we're not able to provide schools with who contact, if their students or staff members are contacts to cases. But when talking with the schools in advance of us making this decision and working through it with them, they didn't feel like there was going to be a lot of change on their end of things because for the vast majority of cases, they already knew about them because families in Knox County and Knox County school parents and teachers were letting them know about their diagnosis or being contacts well before we were able to get that information to them through our contact tracing process. So they will continue to do their end of it. And we're happy with that. We are glad that they're able to continue that. And so hopefully there won't be a dramatic shift in what you see happening at the schools.
From Brian Hornback, if the public has questions, if elected officials have had the vaccine, who would that question go to? The individuals, law department, as I assume Kchd can't reveal health info on individuals.
Yeah, we will not be able to do that. So you wouldn't want to ask individuals on their own status, I suppose.
From Grace with WBIR, I know it's been a bit since we talked about the CDC changes to quarantine periods. Has the 7 and 10-day guidance been implemented in schools yet? And can you please explain how that works, or at least how you're recommending it work?
So the 7 to 10 day change, just to refresh for everybody, those are options. So we will say that the safest measure is always still going to be 14 days. The incubation period for this virus is still 2 to 14 days. And then the other options are that somebody that is asymptomatic at day 10 through day 10 can then come out of quarantine on day 11. Or if they've received a negative test on day 6 or 7, they could leave quarantine on day 8. We've recommended that the schools can utilize that, and they have implemented it. I would go into the details with them, but they are utilizing those methods. But if you want the details of how they're doing it, I would talk to Knox County Schools.
Also from Grace with WBIR, how would you characterize the call volume of people who want vaccines?
Very high. That would be the best way to say it. And there's a lot of a lot of folks are getting frustrated. And so again, that's where we're trying to talk about really managing expectations of how many people are in those priority groups right now versus how much vaccine we have and the challenges that lie with that. So again, please be patient, keep an eye on our social media and our website, and we'll let you know as soon as other opportunities are opening up.
From Alan with Inside of Knoxville, he says, I think an earlier question was intended to ask, would the effect of the vaccine last long enough to get through everyone being vaccinated both doses, or will the people being vaccinated now need to be vaccinated again later this year as we are still working through the first round?
I can't talk about what's going to happen with the plans on whether we're going to go through everybody's first round or second round. Right now, it's everybody gets their first dose, and then the plans are today that everybody gets or should be getting their second dose when it comes time. That's the plan right now. The question you're asking, I guess, is the efficacy piece. And I think that probably with both of the vaccines, and Dr. Buchanan's in here and can hopefully correct me if I'm wrong, it's a little over 50%, I think 57, somewhere like that, after first dose. No, 20. 70. Okay, 70. Say it all.
It's about 70% of efficacy for the first dose, about 95, 96% with the second dose. But I think they're asking about how long immunity from the vaccine lasts.
Got you.
We don't have exact data on that.
Yes.
This is a new vaccine, so we don't have years of data like we have with flu vaccine and other vaccines. Those studies are ongoing. They're looking at the immunity and how long immunity lasts with this vaccine. So honestly, we can't answer that question. The data should tell us how long immunity lasts for this vaccine. This is a large undertaking to get as many people in the country that want to get vaccinated, and we'll just have to follow the science and follow the guidance that comes from that science.
Thank you, Dr. B. I was not following that question.
Thank you. Let's see, from Vincent with Knox News, if you aren't calling close contacts more generally, can you be said to be contact tracing at all? I ask because calling cases individually isn't really following a trail of contacts.
We actually said last week in our media advisory that we were not doing the contact tracing piece, that went out Friday and yesterday. So we're not. We are talking to cases, and we are giving them resources and information that's on our website on how to contact their close contacts and the quarantine and isolation calculator, and asking them to do that. We're really working on personal responsibility, and doing that allows us to be able to support all the efforts that are going on with vaccination, and really start to free up staff to do that. So we're really asking folks to take serious that personal responsibility piece, and let their contacts know they need to quarantine. I'm going to go on and say, before we move on to the next question, that we are also asking employers to trust people when they're telling you that. If they've said that they need to stay home because they're in isolation or quarantine, please make that happen and allow that to happen. We're not going to be able to give letters to everybody anymore, documenting that they are actually in quarantine at this point.
From Allie with Knox News, as we move through the vaccination phases and age groups, how do you expect vaccine acceptance to vary?
I hope it continues to be what we're seeing, which is there's a lot of demand for it, and we want that. We need that to happen, and hopefully people will continue to want to get this vaccine to help protect themselves and help protect the community.
From Grace with WBIR, a week or two ago, Dr. B told us that all your first responder appointments were not filling up. Have you seen that change? Is demand increasing or staying the same?
I don't know the actual answer to that. I know that we've been able to book our appointments at this point. We'd have to follow up with you on whether what our no-show rate's looking like.
Also from Grace with WBIR, when do you expect vaccines to be available to the public through hospitals, doctors' offices, etc.?
That's going to be a little bit of time in the future. They're working with people and groups that they have direct connections with. And hopefully, again, let's go back to the whole hold up in all of this is supply. And so as supply flows more freely, hopefully that'll be sooner rather than later. And general public will be able to start getting vaccine in those categories.
And her follow-up question was, will those appointments be coordinated through Kchd or the individual entities?
We're working on that process, as we talked about last week, and, keep an eye out on how that's going to be done. Right now, they're handling all of their own scheduling and appointments and all of those things.
All right, any further questions, please go ahead and submit them now. From Allie with Knox News, will KCHD's appointment system have a wait list like other counties?
I can't answer that. So our goal right now is, as we get it out, is to have those appointments, and when they're full, and we will have to. I don't know the answer to a wait list right now. We're really trying to prioritize making sure that people know. In other counties, it is essentially a wait list. So when you go on the state system and you click on a county, that gets you on a list, and then somebody from that county calls, is my understanding, and lets you know when your appointment can be or helps to schedule that appointment. We're trying to take the opposite approach, which will have when you register with us, either calling or on our online platform, you're actually getting a time at that point to get vaccinated. And so that's our plan, or a block of time, and that's our plan moving forward.
But those schedules are not out yet.
Yes, those schedules are not out yet.
From Grace with WBIR, do you know when Dr. Gray will be back to give an update on the hospital situation?
With everything that's been going on, I haven't asked Dr. Gray to be back. So we will work on seeing if we can get him back soon.
Any further questions, please go ahead and submit them now. All right, I'm not seeing any other questions come in, so thank you all for your time today, and we will see you again on Thursday. Have a good and safe rest of your day.